Hi guys, welcome to my YouTube channel. My name's Phil and at the age of 48 I was diagnosed with sleep apnea. It's a condition where while you sleep the flap at the back of your throat doesn't open as it should due to the neck being either too large or a person being overweight. I've had this condition for a long time thinking it was normal. It's not. Probably well over 20 years. My symptoms were heavy snoring, waking up very tired, able to drop asleep in a moment's notice during the day, mood swings, irritability, lack of concentration, and stopping breathing during the night while sleeping, making me wake up with a gasp. This I had to get sorted. I made an appointment to see my GP, and while I was there I was asked a series of questions that led to suspected sleep apnea. I was referred to Castle Hill Hospital at Hull, to the lung function department, where I was given a sleep monitor to begin with. This I had to sleep with for a night, and the next day had to return it to the hospital where they would analyse the results and give me the diagnosis. It showed I was stopping breathing up to 22 times an hour, and this was interrupting my sleep cycle, which meant I wasn't getting a good night's sleep. In January 2020, I was given a CPAP machine, which stands for Continuous Positive Airway Pressure. It's essentially a pump that feeds room air filtered through the machine at a constant pressure, around 9 psi for women, between 10 and 11 for men, and it keeps the flap open and allows the body to receive the oxygen that required while sleeping. This is a CPAP machine. Essentially, you've got the on and off button that starts the pump going. Very silent. You can hardly hear it when you're asleep. This is a delay button. It starts the machine off at a low pressure and builds up after about 20 minutes, giving you time to fall asleep. That just changes the pressure, but we don't have anything to do with that. What you get with this, there's the filter in the back, and there you have a hose coming off the back which leads to this mask. Now what you have to do with this is it fits over your head. I'm not going to try and talk with that. It's very difficult. The hose feeds the air to your face through your mouth and nose. This is what gives you your pressure to help you sleep at night. It needs to be a good seal around the nose and the mouth. It can leak slightly, but you just have to reposition it as and when. When I first started using my mask, I had feelings of claustrophobia. You just have to keep wearing it and hope that you can learn to live with sleeping with the mask. Since I've been using the CPAP machine, I've noticed a difference in everyday life. I'm more awake through the day. I don't sleep through the day anymore. And also, according to my partner, I've stopped snoring, which is a huge relief to her. It is very strange to get used to. Some people do actually take a long time to get used to the mask. It is possible. You've just got to keep trying. The best thing to do with these, clean them every day in fresh water. Every week or every 2 weeks, give them a good wash with a non-branded washing up liquid. Some of these can be a bit harsh. This membrane is very soft, and this is how it molds to your face. So yeah, regular cleaning keeps these things, they should last roughly about a year. You can get new ones if required. There are different types of masks. Some fit over just the mouth, some fit over the nose, or like this one, which is the full mouth and nose. But yeah, regular cleaning, you should be okay with it. The CPAP machine can be taken on a plane as carry-on, but it must be declared when you book the holiday. Don't just turn up at the airport with it and hope you're going to put it on. It is classed as hand luggage, but it doesn't go for your weight allowance. It's classed as extra hand luggage. It is worth taking on holiday if you're keeping up the treatment. Don't miss out on any kind of sleep. That's the best thing to do. Now, it has to be said that CPAP isn't for everybody. If you stop breathing less than 15 times an hour, you won't even be considered. Also, it's not a cure. It's an ongoing treatment, possibly for a lifetime. Best thing you can do, if you're a bit overweight, try and lose some weight. Keep going back to your consultant. They will teach you how to use the machine and the best way to do it. It must go back once a year for service and maintenance and checks. They will also analyse results and see how things are going. You must get a minimum of 4 hours sleep a night while using the machine. Otherwise, the consultant or your doctor can revoke your driving licence, especially if you've got daytime apnea. The consultant can also check at any time on certain machines the readings to see that you're actually using it properly and you are getting the amount of sleep that is required. As I said earlier, it is very strange using the machine, but it is well worth persevering. The quality it gives you far outweighs any negatives. It is very strange. Some people do find it difficult to breathe even though you've got the air coming at you. It's just a bit strange. I had to reposition pillows to find a really good sleeping position. I had to sleep on my side. Don't like sleeping on my back. All of a sudden, after a few days, I did have insomnia for a couple of nights. You do just gradually get used to it. If you have any symptoms at all, go see your doctor. Make sure you get checked out. Well, this is only a short video. This is just my little story. I hope you found it helpful, and thanks for watching. Thanks. Bye-bye.